These are from Sanum Kielbeck in Hoya, Germany. And pleomorphism is a concept that goes back to Antoine Béchamp. And Enderlein was a botanist in Berlin in the teens, 20s, 30s, 40s. And he thought that the reason we get sick is because our milieu, our terrain, gets messed up. We get too acidic, we're too toxic, and that's the reason that we get sick. And Pasteur, of course, who was a great French physician who was able to transfer bugs from one person to another and create the infection, and of course started pasteurizing wine, actually was his first thing so it wouldn't spoil. And then, of course, pasteurizing milk we all know about. But on his deathbed, he said, le terrain est tout. The terrain's everything. It's not the bugs that cause the problem, it's how we are that lets bad forms of these bugs grow out and cause disease. So it's all about pleomorphism, that we have several bugs that live in us, and that when we're in bad condition, that these bugs grow into bad forms and make us toxic. Now, so that's where the Sanum people came in. So they give the good forms of these bugs, which mate with the bad forms of the bugs, with the big, long fungal tubes, plug up our circulation, cause inflammation. And the little forms of them mate with the big forms of them, blow them up, back down to the little forms of them. So it's the make love, not war antibiotics. And there are phenomenal different numbers of ways which I'll review to use this, which we'll review today a little bit. All right, this is one of the very biggest ones right here. This is Penicillium notatum. And this is the original penicillin that was developed in 1929 by Sir Alexander Fleming. He was in the Royal College of Medicine in Scotland. He went on vacation. He left the window to his laboratory open. The bread mold flew into the window, landed on a petri dish, and killed all the bacteria. And that's how penicillin was born. Now, this is not like regular penicillin because it has no side effects and doesn't cause any problems. So whenever you have a patent medicine, the drug has to be changed from its original form to be patentable. And so the penicillin is called the acid, is not this stuff. It's also called penicillin chrysogenum. So it's mainly a premier anti-staph and strep remedy. It's a non-specific immune booster. It's great for tonsillitis, otitis, skin infections, urinary tract infections, respiratory infections, periodontal infections. And we don't give muke with it because they copulate with each other and cancel out. But that's kind of a little more esoteric advice there. But what they do with these guys is they take the fungus, which is penicillium is a fungus, and they grow it into its full form like this. Then they explode it with a very strong alkaline sodium hydroxide into little cell membrane forms. Then they filter down to a certain size of cell membrane. Then they dilute that homeopathically to a 4x, 3x, 4x, 6x, and that's what these guys are. So again, you can use the pleomuc to go after the big forms. That's really a circulation remedy, and they call them endobionts. And it's great for burns, sunburns, wound healing, conjunctivitis, frostbite, and pain. You know, angiogenesis is rebuilding new capillaries, new blood vessels, because instantly you put this cream on and any burn will stop. Now, you know, a third-degree burn and your flesh has fallen off you. That's when you want to go to heparin, by the way. The Dr. Michael Salibi, MD, who is an orthopedist at the University of California, San Diego, and the worst burns in the entire world, you just spray them with heparin, you know, anticoagulant, and give heparin IV, and you put it up underneath the bad skin, and they all completely resolve without scars and without disseminated intravascular coagulopathy where the blood shuts down and you die, and the strictures and stuff. So any burn, I mean, that these things, you know, aren't being used. That was one of my very first monthly miracles column was on burns. So we always keep in the kitchen for skulls and grease spatters. It stops pain instantly. We always travel with it. It's phenomenal for sunburns, applied to burned areas immediately, 20 minutes later, 1 or 2 hours later, occasionally the next day, and it stops burns immediately. And frostbite. about 20 years ago, had a 23-year-old kid whose mom was a long-term patient of ours, was driving up from Los Angeles to Reno, up 395, and he stopped at Mammoth because he wanted to take a run up to the top of the hill. And on the way down, it started blizzarding, rain and blizzard and sleet and snow, and he was just wearing tennies. And so he got frostbite on his toes. And he came, so he said, and she called him, "Oh, you've got to see my boy, he just got into town." And here we had these little black and purple toes. So I got out the Procaine, which is the neural therapy we'll talk about a little bit, and some Pleomuke cream, Pleomuke injectable. I injected his toes, we put the cream on there. I said, "Okay, I'll see you first thing next morning." Pink toes. And you know how many kids have lost, people have lost their toes from frostbite in our local hospitals here, when we could be doing stuff like this. It's phenomenal. So you should always carry a little Pleomuke cream. It's also good for skin lesions and senile keratoses, the age spots and stuff we get on our skin. It's great for all that stuff. And it's, it's great for cirrhosis, it's great for hemorrhoids, it does a ton of great things. But for kids, especially great for burns and sunburn. So Muke for burns and lots of other stuff. And you can also put it on sutured wounds, will heal with virtually no scar. And if you do too much of it, it can cause the wound to break down. The eye drops are great for chlorine, sun, wind, allergy, preventing macular degeneration, glaucoma, because they open up circulation to the eyes. And they're phenomenal, and they immediately stop burned eyes. And they look burned, they'll stop their eye drops, and they're great for prohibiting aging diseases of the eyes. Now another penicillium is Penicillium roqueforti, which is like from Roquefort cheese, and it restores health in dysbiosis, bad guts, and mucous membrane disturbances. It's wonderful for adults and kids for GI flus, diarrheas, gastritis, colitis, enteritis, food poisoning, and respiratory flus. It's also fabulous for failure to thrive in babies and with growth disturbances, and especially with multiple antibiotics. So we always travel with Fort. Saved our lives in Cambodia. We got some bad food in Cambodia and immediately did the Fort. And it was very, very helpful, settling things right down immediately. Fort's great stuff. And I have all this stuff. I can buy this stuff at my office. I don't think it doesn't require a prescription or anything. And so it's all available, and I'll tell you how to use it. And you purchase the tapes. Yes, Tom?
Is there a resource guide like the Germany Commission monographs evaluating the safety and efficacy of herbs for these isopathic remedies?
There are, but again, you might call up, as we'll run through a little bit, the company is called Terra Medica, and they have a huge library and resources for this stuff. Terra Medica.